Hello and welcome to our show, Health and Wellness, Myths versus Facts. The endocrine system regulates the release of hormones into the bloodstream. These hormones are important for many bodily processes such as reproduction, metabolism and growth. Diabetes is one of the most common endocrine disorders, and it occurs when your pancreas cannot produce enough insulin or your body cannot use it properly. Today, the number of people with diabetes is higher than ever before, and it's not just your grandparents you need to worry about. People are getting diabetes earlier and more often. Early onset of diabetes increases the risk of associated complications. Diabetes and diabetes-related health complications can be serious and costly. Diabetes can take a serious toll on your quality of life, affecting your physical, mental and emotional well-being. But though there is no cure for diabetes, there are things you can do to manage it and its health complications. Education is one of the most important components to ensure better management and control of diabetes. There's also evidence that improving knowledge about diabetes and its complication has significant benefits, including the increased adherence to treatment and thus a reduction in complications associated with diabetes. There are many misconceptions about diabetes, prevention and management. In this program, our experts provide medically accurate and actionable advice on preventing diabetes and help our viewers identify strategies for long-term control. So let's just talk to our panel of doctors that we have. We have Dr. Tyagi, consultant endocrinologist of Max Super Speciality Hospital here in Delhi. We also have Dr. Joshi, a consultant adult and pediatric endocrinologist, Doshi's Diabetes and Endocrine Cysts. This is the center in Kolhapur. Dr. Saqib Ahmed Khan, director and of the Department of Endocrinology, Chandan Hospital in Lucknow. Very good afternoon. Let's just talk about type 1 diabetes and type 2 diabetes. Those are two different types with different mechanism. Even the age of the onset is different. Are there any symptoms which are similar as far as type 2 and type 1 diabetes are concerned? Dr. Tyagi, let me take my first question to you.
Okay, so thank you, Divya, for this question. So type 1 and type 2 diabetes share often a common set of symptoms which present with excessive thirst, excess weight loss, frequent urination, feeling tired all the time. These patients can also present with genital mycotic infection. However, the only difference between type 1 and type 2 is the rapidity of onset of symptoms. So patients with type 1 diabetes often present with rapid, even explosive onset of symptoms over a matter of few days to weeks. These patients may even present with diabetic ketoacidosis. In contrast, patients with type 2 diabetes usually have a slowly evolving course over weeks to months, and symptoms may not even become apparent till blood sugar levels reach alarmingly high levels. The difference is the time duration it takes for symptoms to present in an individual patient.
Right. Thank you so much for answering that question. Among pregnant women, diabetes is becoming more prevalent, which is the gestational diabetes. Why is it becoming so prevalent among pregnant women? Dr. Doshi.
Yeah, so that's a very relevant question. Gestational diabetes is increasing at an alarming rate. There are certain risk factors that could predispose you to get this gestational diabetes. One is if your age is 35 during conception, or if you are overweight or obese at the time of before your conception, or if you have a strong family history of someone in the family having type 2 diabetes, you are at risk of getting gestational diabetes. If you have had PCOD, PCOS before pregnancy, you are still at a risk of getting gestational diabetes. Or if you have had a previous pregnancy with gestational diabetes, you are at risk of diabetes. And if so, if you are at risk, doctor would check your sugars at two moments. One is once you conceive, and second is at 24 to 28 weeks when your pregnancy hormone increases and gestational diabetes actually appears. So in case if you're diagnosed with gestational diabetes, you need to follow a discipline with your diet, with your exercise, and doctor would also give you some medications, oral medication in the form of metformin. And if it is not controlled with metformin, you may also be advised to take insulin. It is very important to control your gestational diabetes, follow that discipline, monitor your sugars well. Otherwise, it would have an impact with the baby as well as with the mother. But the good news is if you control it well, monitor it well, be in touch with your doctor regularly, you can have an absolutely healthy pregnancy even despite having gestational diabetes.
Right. So whenever we talk about diabetes, we talk about insulin resistance. What is insulin resistance and how does it develop? Dr. Khan.
Thank you, Divya. So it is actually a partial response to insulins by our liver, by our muscle, by our fat. So when this happens, we need to have increased insulin in our body to respond to increased blood glucose level whenever we are going to eat. So it would not be utilized effectively, it would not be stored effectively. So you'll be having a problem with your glucose metabolism and when it appears. Whenever the patient is predisposed for diabetes, whenever the patient is having any genetic predisposition, any diabetes history in their primary, in their siblings or parents, or when it is triggered with a sedentary lifestyle as well as the unhealthy diet, then it might be triggered.
Right. Why, is it necessary to do a test called HbA1c? What is HbA1c, and why does one have to do it when the person has perhaps already done FPG and PPG? Dr. Tyagi.
Okay, so HbA1c stands for glycoside hemoglobin. It is how your, roughly we talk about it, how your blood sugar binds to the hemoglobin in the RBC. So the advantage of HbA1c is that it provides a stable trend of blood glucose value over the last 10 to 12 weeks. The fasting and postprandial sugar levels are very good, but they depend on diet that day, on your physical activity or workout that day, your stress level on that particular time. So there is significant day-to-day and within-day variation in blood glucose levels. So in certain group of patients like who are insulin or who have gestational diabetes, that becomes important. But if you want a stable trend of blood glucose, you want to predict or prognosticate a patient's risk of long-term complications related to diabetes, like eye disease, heart disease, kidney disease, or neuropathy. Here's where HbA1c comes into picture. It's also important to remember that in a select group of patients, like those with anemia, with pregnancy, with or kidney disease, HbA1c is not reliable, and your endocrinologist can order an additional battery of tests to give us a better result, a better outcome of your diabetes.
Right. Well, it's said that with type 2 diabetes, the production of insulin goes down with age. Does it ever go down to nothing? Is it possible to test how much insulin the body still produces? Dr. Doshi.
So that's a very important question. What most people with type 2 diabetes understand is that it is a disease of insulin resistance. We often listen to our patients saying, yes, doctor, my sugars were controlled very well 3 years back, 5 years back with just one medication or just with the lifestyle. But today, despite 3 medications, 4 medications, they are not under control. And they start blaming themselves or their lifestyle or their diet. What most patients fail to understand that type 2 diabetes is a progressive disorder. There is a component of insulin deficiency. So the moment when you're diagnosed with type 2 diabetes, almost 50% of your pancreatic beta cells, a very important beta cells that secrete insulin, are already depleted. And after that, every year, you lose almost 3 to 5% of your beta cells. So there's an ongoing insulin deficiency with the duration of diabetes. And therefore, it is very important to uptitrate your treatment regularly with your doctor and take the help of insulin if it is needed, if your doctor advises you to support your pancreas and the beta cell capacity. The test that could determine your beta cell reserve, your insulin levels, is usually what we do a C-peptide test. That is a surrogate marker. Beta cells throws C-peptide and insulin in an equivalent proportion, and therefore we check C-peptide as a marker of beta cell reserve. That's done in a protocol, and the interpretation is done by your doctor to understand your beta cell reserve.
Right. Let me take my next question to Dr. Khan. Well, what is the time frame for taking insulin before meals? If you forget to take it before eating, can you take it during or after a meal?
So it would be better when you take at better time, like when you are taking fast-acting insulin, it should be taken at least 10 minutes before. When you are taking the regular insulin before meal, when we are talking about the prandial meals, they should be taken 30 minutes before the meals. 20 to 30 minutes is good enough. when we are taking close to the meal, then the chances of having uncontrolled blood glucose levels after the meal is greater. And though the newer generation insulin, they are faster acting and we can afford to even take it after when we forgot to take it. But it would be better if we take it at right time. And for those basal insulin which are not related to meal, they are different. They can be taken at any point of time without any relation to meal. Or the newer generation basal insulin, they can be taken even 6 hours plus minus whatever time we have chosen.
Right. Thank you so much for answering that question, Dr. Khan. With that, we're slipping a very short break. Health and wellness, myths versus facts. We'll continue with Dr. Khan, Dr. Tyagi and Dr. Doshi on the other side. Stay with us. Welcome back. You're watching Health and Wellness, Myths versus Facts with Dr. Khan, Dr. Tyagi and Dr. Doshi with us here on NDTV. Let me take my next question to Dr. Tyagi. Doctor, controlling the amount of carbohydrates consumed and choosing the right carbohydrates is key to preventing and managing diabetes. How simple and complex carbohydrates can be identified by a common person? Dr. Tyagi.
So thank you, Divya. So knowledge about carbohydrates becomes very important because an average Indian diet consists of about 60 to 65% of carbohydrates. Now, carbohydrates can be divided into simple and complex, as the name suggests, based on their chemical structure and how quickly they are digested by your body and cause release of glucose into your blood. So simple carbohydrates, for example, include glucose, fructose, galactose. So they are digested very quickly by your body and they send bursts of glucose into your body. For example, when you take dessert, you feel a sudden rush of energy followed by a crash of fatigue. So this is simple carbohydrate. A complex carbohydrate, on the other hand, takes more time to get digested, causes a delayed but prolonged peak of glucose release. So complex hydrates are the ones which cause you to have the feeling of fullness after eating a meal. But it's also important to know that not all simple carbohydrates are bad. For example, fruits and milk are nutritious simple carbohydrates. So a good diet should comprise a healthy amount of both simple and complex carbohydrates, which depends on so many things: your diet, the pattern, your blood glucose control, your weight. And an adequate diet can be provided to you by your endocrinologist or by your dietitian.
Right. Is only blood sugar control sufficient for the effective management of diabetes? If not, what other factors should be controlled? Dr. Doshi, if you could answer that.
So whenever a person is diagnosed with type 2 diabetes, 75% of the time it is not just type 2 diabetes, it is usually a package of metabolic syndrome, but the patient also has hypertension, that is raised blood pressure, cholesterol, that is dyslipidemia, and controlling all these parameters holistically is equally important for a good quality of life. So we ask our patients to monitor their A, B, C. A is their HbA1c, as ma'am rightly explained. It is not just your one moment glucose. You need to keep your average glucose in target. You keep your blood pressure below 140 by 90. In few cases, even we keep it less than 130 by 80. Keep your cholesterol, specifically your LDL, the bad cholesterol for your heart, keep it less than 70 preferably, or at least less than 100. Along with that, keep an optimum weight, look at your central obesity, look at your waist circumference, try to get into target, and that is equally important like controlling your blood glucose levels. We also ask our patients to do their annual checkup for any kind of diabetic complications. We ask them to get their retina checkup yearly. We ask them to get their kidneys checkup yearly, the serum creatinine. And if there's any leakage of protein from the kidney, we ask them to check their urinary albumin. We also ask the patient to check their sensations of the feet, to check if there's any form of diabetic neuropathy. So screening for this silent complications is going to pick them up very early. And if the complications are picked up early, even before affecting your quality of life, I think we win there, and we can prevent the progression of these complications if they're diagnosed at the right time and not once the complication is set in. So holistically controlling everything, we can have a longer life and a quality of life which is equivalent to people without diabetes. This is possible, but you need to be aggressive. You need to keep those numbers in check consistently and persistently over the years.
Right. So what is the relationship between diabetes and weight loss? Is it possible to reverse diabetes as far as the bariatric surgery is concerned? Dr. Khan.
So there has not been any randomized controlled trial between the other means of reducing your weight and the bariatric surgery, but any weight reduction is good when we are talking about the type 2 diabetes, where at least 2/3 of people are having overweight or obesity, and it itself is a disease, and it invites a lot of other complications. So when we are going for bariatric surgery, there are two kind of procedures. There are restrictive procedures, or there are which are restricting the intake in your stomach, and others are the malabsorptive procedure where there is a diversion. So that the chances of remission or the reversal is there with bariatric surgery. It is more with the more intensive procedures like the procedures which have diverted some part of or bypass some of your intestine, and it has been seen that at least 3/4 of them, they have gone into remission. At least more than 80% they have got better control after going through these procedure. Even Roy Taylor has presented a paper where he has gone through a strict regime of diet with a very low calorie diet in the form of liquid diet with 800 kilocalorie, and he has seen that at least 49% of people were having remission when they have got sufficient weight control. So it differs person to person, yes, but whenever the amount of weight loss is good and it is early in the course of diabetes, you can reverse your diabetes, and it is very rewarding.
Right. Can anti-inflammatory medications increase the blood sugar levels? Dr. Tyagi.
Okay, so thank you. So when we talk about anti-inflammatory drugs here, I want to be clear that we are talking about steroidal anti-inflammatory drugs, and particularly oral or IV steroids. It's important to take note that the inhaled steroids that we use for asthma or COPD, or the topical skin creams which contain steroids like beta-metazole, they are unlikely to raise your blood sugar levels. Now, how steroids raise your blood sugar levels? First, they cause liver to produce an increased amount of glucose in your body. Secondly, now as we take food that converted into glucose, that is taken up by your liver and your muscles to use it more effectively. What steroids do is that they inhibit this uptake of glucose. Therefore, the peripheral blood gets increased amount of glucose. Now, the good thing about steroid-induced hyperglycemia is that most patients, when you stop steroids, their sugars go back to normal. If you need to take steroids intermittently, there is a possibility that you will need diabetic medications also intermittently. However, in a selected group of patients, like who are at high risk for type 2 diabetes, like who are pre-diabetic, who are overweight or obese, who have family history of diabetes, Indians by themselves are at high risk of diabetes, or if you're a woman who has had gestational diabetes. So these patients may develop permanent steroid-induced diabetes. What I want to emphasize here is that the public perception is that steroids are bad. So that is not the case. Steroids are often used in treatment of many life-threatening diseases. So the aim here is to continue steroids while providing excellent blood sugar control with the help of medications or insulin, so that your blood sugar levels can be controlled and your disease, which requires steroids, can also be managed effectively.
Right. Dr. Doshi, if you could reply to my next question being, can prolonged stress cause blood sugar levels to rise?
Yeah, thanks, Divya, for that question. So whenever a person is in stress, there are stress hormones that is released. Usually it's cortisol and adrenaline, and the hormones tend to raise your blood glucose. So that's a physiological adaptation that the body has made. So at this time of stress, you need a little more glucose. And that's why there's a state of insulin resistance in your body, so that the stress is tackled. So once in a while, acute stress, the hormones rise, the glucose would peak. That would not bother much. But if somebody has a chronic stress, chronically if these hormones are raised, definitely it is going to affect your blood sugar levels significantly. And once what we also see is that when stress is managed well, whether by a counselor, a psychologist, or meditation, or whatever way the patient manages it, the glucose comes down back without any additional medication. So managing stress in a patient of type 2 diabetes is equally important as the other parameters are, and definitely has an impact on blood glucose control.
Right. When we talk about diet, is a low GI diet just another fad, a popular diet? How is the GI of food tested? Dr. Khan, if you could answer that.
So GI of food is being tested by a society in Australia, Sydney. So what they do is they compare against the glucose that with certain amount of food, how much is the elevation of your blood glucose level after taking the similar amount of that food against the simple sugar like the glucose. So like we can categorize these into three categories. The foods which are having mild glycemic index, which are categorized from 0 to 55, and with moderate glycemic index with 55 to 70, and more than 70 to 100 with a high glycemic index. So any diet which is adaptable to a person, which can be continued for a long duration of time, which is applicable to the patient according to his or her cultural as well as personal preferences, that would be more feasible. Likewise, the WHO has also proposed a thali kind of method by which you can have a good amount of different foods with low glycemic index, moderate glycemic index food, as well as high glycemic index. It is the balance which is the more important. So whatever suits you, whatever you can continue for a long duration of time, is going to benefit you more. So it is not a fad. Yes, it is a good thing, but even other kind of diet like keto diet and other diets have been found to be successful, but if they can be continued. So if this is lesser applicable, then it would be futile. If it is more applicable to the patient's preference, it would be good.
Right. Thank you so much, Dr. Khan, for answering that question. Also, thank you, Dr. Tyagi and Dr. Doshi, for joining us on the show, Health and Wellness Myths versus Facts on NDTV 24/7. News and updates will continue on the other side.